This presentation describes the advancement of laparoscopic-guided abdominal approaches in cetacean species. It is a partnership with Colorado State University, the Naval Information Warfare Center Pacific, SeaWorld Parks and Entertainment, and the National Marine Mammal Foundation. The benefits of laparoscopic approaches in cetacean includes enhanced visualization of intraperitoneal structures, reduced incision size, leading to more secure closures that allow the animals to return quickly to the aquatic habitat. The purpose of this presentation is to expand diagnostic and treatment capabilities for common diseases in cetaceans. The image on the left indicates a dolphin in a flat but dorsolateral position, allowing access to one side of the abdominal contents. The image on the right indicates a dolphin in a Trendelenburg position. In this case, there are some anesthetic concerns with regards to ability to ventilate for the animal. However, this position allows better opportunities to see the caudal abdominal contents. This slide shows portal placement on the ventral aspect of the abdominal cavity. The initial portal is placed at the umbilicus, and other portals are placed cranially or caudally depending upon which portion of the abdomen to look at. The portals can also be placed in the paralumbar region of the abdominal cavity for better access to structures such as the testis or ovary. Note, the illustration does not accurately depict the shape and configuration of a liver in a dolphin. This video shows the scope placement at the umbilicus using an optical cannula. Other portals can be placed in the paralumbar parainguinal region in order to access structures such as the testis and or the ovary. Internal video here of a Grampus criceus shows the testis and the kidney, some small intestine, moving the way to the cranial aspect of the abdomen, placing additional portals here, in this case using a needle to identify the location, then placing the portal, lifting the liver, and looking at the stomach. So this is the fundic compartment of the stomach. The junction of the forestomach, liver being elevated to look at the spleen, which of course is different in the Grampus versus the Tursiops. The pyloric compartment of the stomach, and the esophagus. The liver with the spleen, elevating the fundus, looking at the spleen, which is different in the Tursiops. The kidney with the adrenal gland, looking caudally at the ureter, which is in the retroperitoneal space, following caudally to the bladder. In this case, we're showing dissecting the peritoneum to gain better access to the ureter, in the instance that there was a ureteral stone. In this case, we are doing a hemicastration in a Grampus griseus male, with the testis and now eventually the vas deferens, using a radiofrequency vessel sealing device. This is now a female Tursiops truncatus. We are looking at the ovary and the broad ligament in preparation for an ovariectomy. We thank you to our partners for helping to develop this video.